Hi, everyone. Today we are here with the Community Health Center of Cape Cod, and in particular, we're here with Chris Ellis, who's the Director of Organization Advancement here at the Health Center. I just wanted Chris to take a moment to introduce himself, as well as just talk about the mission here at the Community Health Center of Cape Cod.
And the mission of Community Health Center is to improve the health of the community through the provision of equitable, patient-centered, compassionate, and high-quality healthcare to all, regardless of their ability to pay. We currently care for more than 27,000 individuals across 7 offices on the Upper Cape, and we really do provide care for anyone who needs it. Currently, just about 78% of our patients are under 200% of the poverty level, which is around $63,000 for a family of 4. So a lot of the individuals who come to us for care are folks that are maybe struggling with finances and having to choose between healthcare and other options. But we also provide care for anyone who needs it if they have private insurance or Medicare, because we do offer, good integrated services for anyone who's in need. The integrated services that we provide range from primary care, behavioral health, dental, optometry, pharmacy, recovery services. So we offer a wide range of services all under one roof for anyone who needs it.
Awesome. Thank you, Chris. That's wonderful. Obviously, an important service that you provide here for our community. I just wanted to talk a little bit about the recent grant that Cape and Coast Bank provided to you for $10,000, and it was about your Sandwich branch extension, and how is that impacting the community there in Sandwich?
We're so grateful for Cape and Coast support for our Sandwich expansion and opportunity here. We have the sign right here. So right now we do have a very small satellite office in Sandwich, which pretty much offers primary care and a little bit of behavioral health and recovery services. Sandwich has always been a kind of area of need where we've been increasing the number of patients that are looking for access to care. So with the support of the bank and with others, we're going to be building a brand new facility right on Route 6A, 85 Route 6A, that's going to, in addition to expanding the primary care and behavioral health and recovery services, it's going to add dental care, it's going to add optometry, it's going to add a full service pharmacy, it's going to add a wide range of other services, including walk-in care for people that just have some urgent needs day of. So it really is going to be, what we're hoping to be kind of just a healthcare hub right there in Sandwich for residents of Sandwich or anyone who needs it. Another unique thing about the Sandwich expansion is we're going to have 2 apartments within the center. So it's going to be for workforce, because we know how challenging that is for folks that are, struggling to find a place to stay, that they can maybe get their start there if they're just moving to the Cape. So we know that that's going to be a really important piece.
Wow, that sounds amazing. And I think the piece about the workforce housing as well, because obviously that's a challenge that we see here on the Cape, and we support many organizations addressing those challenges pertaining to housing. But what if you could let me know more about just a story that you love to talk about when it comes to the Community Health Center?
So one story that came to mind about kind of just, the impact that we have is an individual who came to us for care, and not just for primary care, but this person was struggling with some behavioral health issues and some substance use issues as well. And he came to us for care and was, a little skeptical at first. But what he said after his appointment is that, we treated him with such respect. We treated him like a person. And the quote from him is that with his primary care provider specifically, he said, if there were more people like this, the world would be a much better place. One of the unique things about some of the services we do offer, I mentioned behavioral health and substance use disorder services. They're all fully integrated into the services we provide here. So if you are coming to Community Health Center for a behavioral health appointment or a recovery service appointment, you're not going to that specific clinic or that specific side of the office. You're just coming in to check in for a regular appointment. So it really does reduce any kind of stigma that people might feel. Because when I'm out in the community, I hear a lot of people say, how much we've impacted them. From the communication side of things, I take a look at our patient surveys that we send out on a regular basis. And I took a look over the past 3 years, and I looked for the term "saved my life." And I found 8 different instances of patients in a survey saying that we were able to save their lives. And as an outpatient clinic where we're not doing surgeries, we're not curing cancer, we're not, performing life-changing operations for individuals, we are able to make that impact and make, really help these people make life-altering changes. And we're, so happy to do that. And the team that we have working here does an amazing job of that for our patients.
That's incredible. 8 times saved my life. I'm sure, I think we all understand how challenging it is to access healthcare here on the Cape and how the length of time it can take to access a physician. So to have a resource like the Community Health Center who can provide immediate care for our community is just so immensely important. Along those lines, because obviously you have a wonderful process set up, you have a wonderful service offering set up. I'm just wondering along the lines of your future and where you're going.
So yes, we're always, looking ahead, and patient care is really at the forefront of everything that we do. This question comes at a perfect time because we're actually embarking on our next strategic planning process. We actually had a meeting yesterday to talk about it with our kind of management team. So we've really kind of identified 4 different kind of pillars that we're going to be focusing on for the next 3 years. One is providing increased access to care. So making sure people can get the right care at the right time, at the right place. The other is operational excellence and innovation. So making sure we're kind of staying up on the trends and making sure that we're, doing what we need to be doing to best care for our patients. The third is to have a sustainable business model. So to make sure that what we're doing is sustainable and making sure, financially and operationally and just kind of across the board, looking at everything that we do, making sure that's sustainable. And then the 4th pillar is really involving our staff and making sure that they're empowered and, that we're able to kind of retain and recruit the right staff, because our team is so important to the work that we do.
To get a little bit into maybe some of the challenges that CHC is experiencing at the moment, and as community partners and as employees there at the bank who will be listening to this, is there just some suggestions? First, maybe let us know on some of those challenges, but are there also some suggestions on how to get involved and how can we as your community partner help alleviate some of those challenges?
It's having the patients that are coming to us, it's having the staff that we're recruiting and retaining, and it's having the individuals and the organizations to support us. So as far as finding ways to support that, we kind of have an unofficial ambassador program of people that are, just supporting Community Health Center, whether they're referring someone to come work for us, maybe they're referring someone to make a donation to us, or just spreading the word about what we're doing. So that's really kind of a big way that employees and others can support the work that we're doing, is just by being an ambassador of ours and kind of letting people know what we do and how they can help us. But if you do visit our website and you scroll down kind of past that top image, there'll be a bar about getting involved. So from there, you can click on a button to become a new patient for people that are looking for care. You can click on a button to get involved, which will give you some information about volunteering and about supporting. And there's a button on the top of every page that says donate now, which it doesn't take you immediately to just say make a donation to us, but it tells you a little bit more about getting involved. It has my information on there as well. So you can always, visit that page just to kind of learn more and figure out how to get involved and how to just be kind of part of our CHC network and be able to support what we're doing.
Fantastic. Thank you so much, Chris, for being here with us today and giving us so much information and such insight into the Community Health Centers of Cape Cod, which, as I'm sure, as you've heard today, is such an important resource for our community. And as Chris said, if you're looking to get involved, please check out their website. Thank you very much.
Thank you.
Thank you.